Picture this. A 6-year-old guy walks into the clinic. He's complaining of severe, explosive, watery diarrhea, and it's been going on for months. While you're examining him, you notice this sudden, episodic flushing. His face and neck just turn bright red. And when you take a listen to his lungs, you hear very distinct bilateral wheezing. Salam, welcome to A Little Push, 5 minutes medical mnemonics. So, based on that clinical picture, what's the diagnosis? What single, highly testable condition links all these classic symptoms together? We're looking at a very specific pathophysiology here, and honestly, it's one that board examiners absolutely love to throw at you. Okay, let's dive right into this. To permanently lock the gastrointestinal and endocrine features of this syndrome into your brain, we're going to use a super high-yield mnemonic. Just remember, be FDR in a cool car. It's catchy, it's highly visual, and it elegantly ties the clinical symptoms directly to where the tumor originates, plus its unique physiological mechanisms. Let's break it down, letter by letter, starting with B, which represents bronchospasm. Just like we saw in our initial case study, these patients frequently present with bronchospasm. The vasoactive substances released by the tumor actually cause the airways to constrict. This results in clinically significant wheezing that, believe it or not, can sometimes be misdiagnosed as asthma. Next up, F is for flushing. Now, what's really interesting here is that we're not just talking about a subtle, continuous red hue. No, we're talking about paroxysmal, episodic reddening of the skin. It typically presents very prominently on the face and neck, and it's driven directly by the sudden release of those vasoactive peptides dumping right into the systemic circulation. Moving right along to D. D stands for diarrhea. This is a massive hallmark of the syndrome. It's almost always described as severe, watery, and explosive, which obviously leads to significant discomfort and rapid fluid loss for the patient. Then we hit R, which stands for right-sided heart failure. Now, the absolutely crucial point here is that this heart failure comes from physical damage to the right-sided heart valves, specifically tricuspid insufficiency or pulmonary stenosis. This happens because that circulating serotonin mediates a fibrotic reaction. It literally damages and scars the tissue of those valves over time. And what about the car? Well, car acts as your anchor. It reminds you that this entire crazy cluster of symptoms, the wheezing, the flushing, the diarrhea, and the right heart failure, points directly to the carcinoid diagnosis. It's Carcinoid Syndrome. Let's move to our last mnemonic word and see how this completes the picture. COOL stands for Kolchitsky cells. These are the specific neuroendocrine cells, also known as apudemas, meaning they take up and process amine precursors, from which these serotonin-secreting tumors actually originate. You'll most commonly find them in the small bowel, specifically hanging out in the appendix and the ileum. High-yield clinical correlations, or as I like to call them, the secrets. Let's get right into it. All right, a classic exam question asks, why is the heart damage limited strictly to the right side? This brilliantly illustrates what we call the lung filter rule. The right heart is exposed to and damaged by the serotonin coming from the systemic venous circulation. But the left heart? It's totally protected. Why? Because the lungs act as a massive filter. They contain an enzyme called monoamine oxidase, which effectively inactivates the serotonin before the blood ever even reaches the left side of the heart. Pretty cool, right? When it comes to diagnosis, the definitive initial test is highly specific. Just picture a 5-high car pileup. Let that mental image permanently imprint in your mind so you remember to look for an elevated 24-hour urinary 5-HIAA level. 5-HIAA is basically a breakdown product of serotonin. When a carcinoid tumor metastasizes, which is usually to the liver, it bypasses hepatic degradation, and those 5-HIAA levels just completely spike in the urine. Now for treatment. When you're managing acute, really distressing symptoms like that flushing and severe diarrhea, your first-line pharmacologic treatment is octreotide. Octreotide is a somatostatin analog that inhibits the release of those vasoactive peptides, bringing some much-needed rapid relief to the patient. All right, it is time for a rapid review quiz. Let's test that active recall. Question 1. What is the definitive initial diagnostic test for carcinoid syndrome? If you pictured that 5-high car pileup, you nailed it. The answer is an elevated 24-hour urinary 5-HIAA. Question 2. Why is the heart damage limited to the right side? The answer is the lung filter rule. The lungs contain monoamine oxidase that completely inactivates the serotonin, perfectly protecting the left heart. And our final question: what is the first-line pharmacologic treatment for acute flushing and diarrhea?
The answer is octreotide.
Excellent work today. Mastering these high-yield mnemonics and clinical correlations is exactly what gives you that extra edge on your exams. So what medical mystery will you conquer next? Be sure to subscribe for more clear, focused explainers just like this one so we can keep building up your medical knowledge together. Until next time, salam.